Alright, this is Josh Rubin from East West Healing and Performance. Today we're going to talk about high heel shoes and overall kinetic chain pain, meaning body pain, from the teeth to the shoulders and neck, to the back, to the knees, to the torso, to the pelvis, and on and on and on. The body is connected, so if you alter the feet, the whole body is going to be altered. What got me to do this YouTube, the interesting thing is nowadays we have women, altering their breasts, altering their faces and everything with plastic surgery. Happened to be switching the channels maybe last week, and there's this talk show called Doctors on TV, which is a quite ridiculous show in my opinion, but they had this doctor on that did cosmetic surgery to the feet, and what he did was, if this was your foot, he shaved down the bones in the feet so women's feet could fit in their shoes because women want to wear such nice shoes. Well, I can tell you right now, if you alter your feet, you're altering the sensory input that your body takes in, which alters motor output. So if you alter your feet that are naturally designed in a certain way, you're going to decrease your base of natural support, and you're going to affect the whole kinetic chain. So your body's going to start to shift over time. In the long run, you're not going to see problems in the feet, which you probably will see some dysfunction, but you're going to start seeing problems all the way up the kinetic chain. And these people typically down the line, 5 to 10 years, start to have knee pain, then pelvis pain, then low back pain, then shoulder pain, then neck pain, and then TMJ pain. And what do? They go see the shoulder specialist, the TMJ specialist. And everyone's got binoculars on trying to fix this person, when all in all, the body's telling them exactly what's going on. It's a foot dysfunction creating everything else. So we have women nowadays, there's a lot of pressure out there, a lot of women are wearing high-heeled shoes, and I'm not saying don't wear high-heeled shoes. I'm just here to educate you. Every time you put on a high-heeled shoe, most women, I can guarantee they end the day and they take their shoes off and they take a big sigh of relief because their feet are in pain, they're swollen, they have sores on their toes, their feet get cramped together, they have bunions, and it just absolutely hurts. So the question is, why are you wearing them? For the looks, so because it goes good with the outfit. Of course, that's common, but you're sacrificing your health just to look good. And looking good doesn't mean health. So I'm going to educate you on something. You can look at this graph that I somewhat drew. And this is research from Paul Chek and a doctor named Elizabeth. Can't pronounce her last name, but I'll spell it. Arendt. She's a doctor, and she has a lot of research articles. She has a book called Common Musculoskeletal Injuries in Women. But if you look at this graph, see if I can, okay. So, I don't know if I can do this, but this is neutral, a neutral body. Every time the body, you put on a heel, for every inch, okay, a heel is, the body gets thrown forward about 11 degrees, or somewhere in there, okay? So if you have a 2-inch heel on, the body gets thrown forward 22.5 degrees approximately. So that line is basically your body getting thrown forward. If you put in a 4-inch heel, the body gets thrown forward 45 degrees approximately, and on and on and on. And if you wear a 6-inch heel, bottom line, you're a prostitute. No, I'm just kidding. So if you look at that, obviously you're not walking forward at a 22 or 45 degree angle. You can't do that. You wouldn't be able to walk unless you're a superhero. But what the body has to do, the body has to compensate from the ankle all the way up to the cranium in order for you to actually walk and stay level to the horizon. That's what our body is designed to do. Whatever happens, whether it's a respiration dysfunction, a jaw dysfunction, a low back dysfunction, anything you can think of, the body is always trying to maintain horizontal vision so you can see where you're going. And that's why you see a lot of people with forward head posture, from altered respiration, altered TMJ muscles, and chewing on one side of the mouth, carrying bags, sitting forward. The body is always going to adapt to its stressors. It's called the SAID principle, specific adaptations to imposed demands. Okay? The axis of rotation of this head is right through the auditory meatus, and the center of gravity is right anterior to that. So anytime the center of gravity goes forward, the head's going to fall. You can't look at the ground all day when you walk, so these neck muscles, they adapt to turn on to pull your head forward so you can still see where you're going. So same thing with high-heeled shoes. So I'm going to give you some examples. These are my drawings. They're not too fancy, but it's just so you can see, okay, you can't see my face, but so you can see these postures with high-heeled shoes. So A is a person wearing high-heeled shoes, my stick figure, and where that asterisk is, or star, that's showing you one of the postural dysfunctions that can happen from wearing high-heeled shoes. Okay, so let's see if we can get a better view with my face. We can't, but I'll hold it to the side. So that's showing that one of the possibilities is hyperextension in the low back. The body's going to compensate in the low back and hyperextend so you can continually wear these shoes and stay level with the horizon. So you have low back pain, you go in, they try to fix your low back, it doesn't work. Well, is it the low back or is it the footwear? B, let's look at B. B is showing you hyperextended knees, hyperflexed knees, okay, or your knee is too bent with a flat back, and you see this a lot in women, okay? So it's too much of an increased thoracic and lumbar curve in a C shape like this with hyperflexed knees. This is another compensation. You see these women with chronic low back pain, chronic shoulder pain, and upper back pain at the end of the day. Is it back pain or is it the footwear? C is showing you hyperextended knees, okay? And you see this a lot in women where their knees are hyperextended backwards instead of forward, so their knee is really straight. And this is overcompensation of the quads and the hip muscles to compensate for the 2 or 4 inch heel that you have on. So these women commonly have hip and knee pain, okay? And the fourth is your, basically, or D, is your neutral posture. Normal knees, normal pelvis, normal lumbar, thoracic, and cervical curve, okay? There's many more compensations that can happen. My goal is just to educate you and show you that, you know, not to stop wearing high-heeled shoes, but to educate yourself. If you're going to wear high-heeled shoes, have a practitioner look at your posture to see if you have flexed knees or if you have a flat back or too flexed of a pelvis. Because what they could do is design an exercise program to stretch the muscles that are overcompensating and strengthen the ones that are too weak. For instance, if you have the hyperextended knees, and this is a generalization, your quads and your psoas are going to be over-recruited and become short. Your hamstrings and glutes are going to become lengthened, and that's how you get the hyperextended knees. So what they can do is design a program to stretch your quads and psoas and strengthen your hamstrings and glutes to help kind of compensate for you wearing high-heeled shoes. Not to say in the long run you won't still end up with knee and hip pain, but it's just, I guess, a simple way to help balance the issue if you still want to wear high-heeled shoes. So hopefully you learned something, another kind of holistic approach to pain in a sense, because we're looking at the root, not the branch, which is the symptom. So if you want to learn more, go to our website at eastwesthealing.com, our blog at blog.eastwesthealing.com, or feel free to pop us an email or a phone call to ask us any questions you might have or set up your free consultation. Hope you enjoyed the YouTube clip today, and stay tuned for the second edition of low back pain, a holistic approach.